Good evening. Today is Wednesday, April 15th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Public Information Officer with Stanislaus County. We will be moderating tonight's live event, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on camera tonight, but you will hear our voices as we help monitor the live feed and also direct your questions to our panelists.
Joining us tonight is Dr. Julie Veshampayan, who we will refer to as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Behavioral Health and Recovery Services Director Ruben Imperial.
Let's start things off with Dr. V, who will provide us with an update on the latest number of cases of COVID-19 in our community. Dr. V, what is the status of COVID-19 right now in our county?
So today we're reporting 177 cases. We still have 4 deaths. 77 people have recovered, and we have about 2,700, little over, negative tests.
And is this on target with what you expected to see?
Well, we've had a pretty good increase in cases over the last few days, going up 14 today, going up quite a few yesterday. So I had hoped we wouldn't be seeing this, but we are seeing this, and I think it just shows that there's still COVID-19 spreading in our community, and we still need to do everything we can to keep social distance and stay at home.
Thank you, Dr. V. So our number one concern from the Facebook community is related to testing. Are there any updates you can share with the community regarding testing?
Well, so we've talked each week about some of the barriers we're facing with testing, and one of the big ones is the swabs, and I talked quite a bit about that last week, and we're still having some difficulty obtaining the swabs to even start the testing process. We are trying to increase testing in our county, and we're pursuing some options and working with some vendors and looking at some drive-through testing.
Thank you, Dr. V. Our next question is for Sheriff Dirksey. Last week, the Judicial Council of California recently reset bail to 0 for most all nonviolent crimes in the state. On Monday, here in Stanislaus County, more than 60 inmates were released. It's only been a couple of days, and so this person is asking, have we seen any sort of impact on crime since that release?
It's too early to tell on that. The simplest answer is it's only been 2 days, and statistically we can't answer that yet. But kind of by way of update on that particular topic, first, let me say that I have a whole separate video that we put out specifically addressing the JCC and their change that they made and why they made that. If you want more details specifically to that, I would tell you watch that video. So on Monday, we released 54 inmates as a result of this new 0 bail change. Of those 54 inmates, 28 of them were already on probation for prior convictions. So many of them, it was not their first time that they were in jail. Since then, we have released an additional 45 inmates. And the reason that this goes on is that we had a large list the first time that we had to evaluate, determine those that met the criteria, and they were released. Then we have to kind of go back through the weeds, if you will, and sort out specific cases. Many of these people have multiple cases. Roughly half of them have multiple cases, and so we have to look at each and every case and each and every charge. With that, too, our DA's office has been working very hard to file essentially what are called bail enhancement motions. So if someone potentially qualifies for 0 bail, the DA can go and make an argument before the court regarding why they should not qualify given their proclivity to commit crime or whatever the case may be. And so that process, and then of course the public defender can make a counter argument to that, and then that goes before a court hearing. So that process is going on. That's one of the reasons we've also released a few more in the last few days. And then moving forward, I would expect that today, still this evening, tomorrow, we'll get even more of those minute orders, the orders from the court specifying what someone's bail will be, what it will be changed to. So there will be more releases. With that, we are tracking all of those who are released, and we are tracking our crime trends. Now, we're not tracking the individuals in the community. They are not wearing a GPS monitor or anything like that. There is no way for us. There was no mechanism for that under this 0 bail order, so we really can't do that. but we are, through our computer systems, we are tracking if they reoffend. We are tracking, like we always do, our crime stats, and if they're going up, property crime has been going up, that's for sure. Not dramatically, but there has been a steady increase over the last 2 to 3 weeks. And with that, the vast majority of those who are released from custody, many of them are regarding theft-related issues. The number one charge, grand theft auto. So I would encourage everyone out there, make sure that you secure your vehicles because there are more car thieves on the streets.
I wanted to stick with you for just a moment because this question also correlates with what you just said. This question came in over our Facebook feed over the last couple of days. We understand that you've also modified patrol staffing to keep the community safe. So what does that look like?
Yeah. So obviously this is very concerning not only to me as the sheriff, but all of our police chiefs across the county, all 9 of them, they are all equally concerned about this. And so specifically at the sheriff's office, what we've done is we've reassigned our patrol staff. And we've done it for 2 different reasons. One is to both protect our patrol deputies so that if we do get an infection within the department, then we can kind of limit that to a certain squad. So that's one of the reasons. But we've also done it so that we can get more deputies out on the streets actively working to prevent crimes from happening. And not only have we reallocated some of our patrol staff, but we've also taken some of our specialty units, our community deputy unit, our special vehicle unit, and we have reallocated them directly to patrol. So on any given day, on any given shift, there are at least 15 deputies that are working the streets, which is almost double what it used to be, about half again as much. And we have at least 2 or 3 sergeants and a lieutenant on duty. So there are a number of additional cops that are out on the street, specifically out there to protect the community. Additionally, we reassigned our air support unit, which is our helicopter unit. It's a specialty assignment, collateral assignment, so they would only fly at certain times. We have staffed that unit full-time now. So the helicopter is going to be flying around 7 days a week. You will see a lot more of it. Just because you see it, it does not mean that you need to be alarmed. They are doing obviously patrol-related things. They may be on, a hot call or a more critical call, but they're also doing a number of other things. They are flying over our schools, a lot of our closed businesses, specifically to prevent theft, looting, and so on. They're also looking for homeless camps so that we can try to address those moving forward proactively. So you'll see the helicopter a lot more.
Thank you, Sheriff. Terrific to hear about all the enhanced safety measures happening right now. We are going to talk now with Ruben Imperial. Welcome, Ruben. You are the director of our Behavioral Health and Recovery Services Department. Can you tell the community a little bit about what your department does?
Yes, we're the county's behavioral health department. We provide mental health services for adults with severe mental illness and for children with severe emotional disturbances. And we also provide outpatient and residential substance use disorder treatment as well. And we are the county's public guardian.
Thank you, Ruben. So this next question has a lot to do with what Sheriff Dirksey was just talking about, the release of inmates. We know that your department has a lot to do with mental health programs for inmates. Have you tried to make contact or reconnect with some of those inmates? What are you doing in that realm?
Yeah, no, we have great partnerships with the Sheriff's Department, our probation department, all of our law enforcement partners. And what we did is we coordinated with them. We were able to identify the folks that were being released and those that were connected to our treatment services currently or in times past. And we actually were in contact with them as they were releasing them, making sure that for those that were being released, we were able to provide options for them in terms of getting an assessment or back into treatment. Also, those folks that were being discharged with, psychiatric medication or other types of things, we were also coordinating that with them as well. So it was for those, at least with severe mental illness that we had been connected with, we knew who they were, and we were able to coordinate with the Sheriff's Office upon their release. So.
Thank you, Ruben. This next question is for Dr. V, and this is in regards to the numbers. This was a Facebook question that came in over the last week, and the question is, why are there so many negative test results? This person's understanding is that only highly suspected illnesses are tested, and could these be false negatives? And they also want to know, are the recovered numbers reported each day part of the total number of positive tests?
Okay, so I'll try to remember to answer all of those. We don't necessarily know all the people who are testing negative. Providers out in the community can order the tests, and so it's not reported to public health what their symptoms are. So that makes it hard to speak with, are they false negatives or true? That's hard to answer. A lot of the ability to get a positive test depends on how well the sample is taken with that swab we were talking about. So that's a difficult question. But what we do see, I guess, and one other thing I'd like to say about that is there are many reasons to have a fever and a cough and shortness of breath. This COVID-19 isn't the only thing causing disease. Influenza is still around, and so there are other viral respiratory diseases that can be causing this. There's many others that we can talk about at some time. But so just because it's not testing positive for COVID-19, I would say that the actions people should take are still the same. They need to stay home when sick, and not go places and risk transferring the infection to someone else, whether it's COVID-19 or not. Did I hit all those questions?
The second portion of the question, and this is actually a question we received quite a bit. Of the recovered numbers that are reported each day,
yes.
Are they part of the total number for positive tests?
Yes. So those are people that we have reported as positive who have since recovered. So they are included in the total positive tests. So if you take the 177 and we have 77, I believe, if my numbers are remembering correct, so that means 100 people are still not considered recovered at this time.
Thank you for clarifying that, Dr. V. Here's another question that came in from one of our Facebook viewers. Jeanette wants to know, can you tell us what the turnaround time for testing is and how many days we are behind?
Yeah, so in the beginning when the commercial labs came on, or even before that, when we had to ship across the country to CDC, there was a longer turnaround time. Turnaround time is very short now. It's averaging at 1 day. So we are getting test results back quite quickly, which is great. It's very helpful for everyone. I mean, that's the average. So it's shorter, because if you get it in, you can get answers same day, depending on the timing of the sample. And there is longer, so not everybody's going to get it, but our average over all the tests, we just looked at it again today, is 1 day. So that's a great turnaround time right now.
Thank you, Dr. V. This next question is for the sheriff. A viewer wrote on our Facebook page, we're now weeks into the shelter-in-place order. This has hurt many people's ability to go to work. Have you seen evidence of this frustration, and are people more agitated or depressed as a result?
Yeah, as far as the agitated or depressed, that's probably going to be specifically a better topic for Ruben to address. But what I will say is this: we are absolutely seeing an increase in alcohol-related crimes, whether it's drunk driving, public intoxication, any combination thereof, and also potential suicide attempts. There is, I can't give you kind of the statistical update or uptick at the moment, but they are definitely out there right now. And I think what you're seeing specific to the alcohol side of it is people are either a combination of bored, depressed, angry, looking for some sort of escape, and so they're turning to alcohol, and they're getting out there on the streets, they're driving, and they are putting themselves at risk, they're putting the public at risk simply by doing that. And so, it would, like all things, everyone needs to, if you're going to drink, stay at home. You're supposed to be staying at home anyway. So don't get out there in public and do that, because you're causing a problem, obviously, for the public in general. And you're actually increasing calls for service in those particular categories that my team has to deal with. That's preventing us from dealing with other things like theft-related issues.
Thank you, Sheriff. Ruben, this one's for you. So we have seen in the news that alcohol consumption is up, and we just heard the sheriff talk about that. We also know that medical experts have talked about the health impacts of COVID-19 running deep and how this can be a trigger for stress response and depression. What would you tell someone who thinks they're experiencing a mental health crisis?
Well, The first thing I'll say is that this is an unprecedented time, and it's unprecedented for many parts of our community, for our system, for our services, and in behavioral health, this is also an unprecedented time for us. I think in addition to the public health crisis related to COVID-19, we're in a crisis in our community, around just social isolation and people lacking connection, and it's important that folks, when it comes to their behavioral health, and understand how important it is that we continue in some way to connect with others. And although we're physically distancing ourselves, that it's very important to make very intentional efforts to reach out, to connect, to build support for yourselves. And in the event that is not there for you, and if you are concerned about your mental health, whether it's a mental illness, or you're feeling anxiety or depression or substance use issue you're concerned about, we'd like to let you know to call us and let us help you figure out what level of support you need, what might be able to connect you with your health provider, might be able to connect you with community support, and also treatment at times. So we do have our access line that is available for our community. The number is 558-4600. And we want the community to know that if you are concerned about a mental health, a substance use disorder issue for yourself or a loved one, you don't have to figure out that alone. I know folks have questions about signs and symptoms, and if the first sign is if you have a concern, call us. Let us help you figure out what would be a good next step and help you get to the support you need, or the treatment that you need. And I will say, anxiety or depression right now is given the circumstances are in, is a reasonable thing to feel for all of us. We're all experiencing this event, and we're all experiencing it in different ways. And for some of us, we have really healthy ways of coping and dealing with everyday stress even before COVID-19, and that's carrying on into this crisis. But for some of us as well, the way we've dealt with things before COVID-19 and all the added stress and anxiety and the things we're hearing, maybe it's time for some of us to reach out and call for some extra help or extra support. And that's why we want folks to know they can call us, we can help them figure out those questions, and that number is 558-4600.
Thank you so much, Ruben. This next question is for Dr. V. This comes in right after the Easter weekend, and also Passover. This is from Casey Zia. Casey wants to know, will churches not be allowed to gather for up to a year?
That's a hard question. As we look towards the future, this virus we have no indication that this virus is going to go away. Our assumption is that the virus is going to stay with us, and we do not have enough people who have been infected yet to have what we call herd immunity. I'm sure you've heard that. We need 80 to 90% to get good herd immunity. There are many people in churches who are at risk for severe disease, and we want to make sure they are protected. So as we look to the future, one of the things that we're seeing is that we need to find a new normal until we have a vaccine out, or if this virus happens to go away, that's great. But so what will this new normal look like? How can we look to the future at the things we do, whether it's restaurants, whether it's churches, the way that we do our business and our play, and how can we do that in a way that is going to not put people, especially people at risk for severe disease, at risk for infection. And I think it's going to take all of us thinking about how we reimagine this. So how will churches look like over the coming year as we look at how we can open up activities without putting more people at risk? So it's going to take all of us thinking together and coming up with a plan to address this. So I don't yet have an answer to your question, and I think input on this would be great about how this can be done in a manner that doesn't lead to spread of viral respiratory infections.
Thank you, Dr. V. We're going to stay with you for a second because I have a related question here. Many of us watched Governor Newsom's briefing yesterday, and he called this the optimistic phase. He said that we have bent the curve, and we will slowly now soon be transitioning from surge to suppression. He suggested a modified shelter-in-place order may come in the next few weeks. Do you think that timing makes sense for us here in Stanislaus County?
I think that will remain to be seen. So we are, we've been seeing quite a few cases lately, and so we are lagging behind the Bay Area. As you know, they were having a lot of cases when we really didn't have any, and so now we're having a quite large percentage increase each day, and that's not what they're seeing. So we're lagging behind them in a few weeks. So what will it look like in a couple weeks? I'm not sure. So we'll have to wait and see what the timing looks like. I know Governor Newsom said in a couple weeks, maybe we'll start talking about a date, so we will be reassessing, looking at where we stand at that time and seeing how this works for us. So that's the best answer I can give right now.
Dr. V, since you brought up the notion of herd immunity, did you want to explain a little bit about what that is?
Yeah, so herd immunity is it's the level of immunity in a population. It comes from animal science, as you can tell, so I guess we're a herd. So it comes from the level of immunity that's built up to prevent spread of disease, or keep it down to a level, as they say, a simmer, not a boil. So keep it down to a level where healthcare system can keep up, and it's not overwhelming society with absenteeism from work and things like that. So that's really what herd immunity is about, having a level of people around you that are not susceptible to the disease, and that slows spread.
One more for you.
Okay.
This Facebook question came from Melanie. She wants to know, what has public health done in regards to contact tracing of the positive COVID-19 cases, and are families and friends being monitored, or were they tested?
So we get a lot of questions about what contact investigations look like. So when we get a report of a positive case, and by law it is required to be reported to public health, so we should know about all of them. I saw that question come in. We contact that person, and we establish when the symptoms started, and so we establish what we call the infectious period. And then we ask them to, where have they been during that time, have them pull out their calendar, really look at where they've been and who could possibly have been exposed. And then we notify those people about the exposure. The highest risk of exposure is in household contacts, because they spend the most time with the person, and they're in the same environment. They're spending more time face to face. Most people feel more comfortable in their home and, sit on the couch side by side. And so most of what we see is spread in homes. And so that's important to look at who's symptomatic, who could possibly be infected. But that's basically what we do in a contact investigation.
Thank you, Dr. V. This next question is for Sheriff Dirkse. This comes in from Rachel Barfield Wilder off our live Facebook feed. Rachel is asking, will there be any way to reverse the zero bail ruling prior to the end of the state of emergency for California? Or is it set in stone until well after the emergency is lifted?
So the short answer is yes, it could be redone. So kind of the update on that is that the JCC ruling is in effect until the state of emergency is over, plus 90 days. And so it would, if it ended on July 1st, and I'm not saying that it will, so please don't go down that road, but if it ended on July 1st, it would extend for 90 days past that. So with that, it was a court ruling, so the court could issue another ruling changing that. Obviously, that is not something that is within our control, but yes, that could be done.
Follow-up question also from our live Facebook feed. What type of crimes were released inmates committing?
So the number one crime of all of them, so we've released 99 prisoners to date as of 2 hours ago. And so of that, the number one crime that they had committed across the board was grand theft auto. That was the single biggest crime category out there. With that, though, many of the crimes revolved around theft in general, whether grand theft, burglary, petty theft, shoplifting, something in that category. Then the next biggest group would have been drug offenses. And we're not talking about misdemeanor drug offenses, mere possession of drugs or paraphernalia. Many of those that were released were arrested for transportation or sales of drugs. So, typically larger amounts of drugs. We had several that were arrested for, there's a specific charge for a weapon and drugs at the same time. Several of those were on there. And then also assault likely to cause great bodily injury or death. So this is not simply crimes, non-violent crimes. There are a plethora of crimes across the spectrum that are required to be released under zero bail. As a colleague of mine said, clearly a lot of things aren't that serious anymore, which is not something that we agree with. Many of these folks should stay in jail. I spoke about this earlier, but over half of them were in jail for more than one case. The highest number that I saw was 6 on our list. And of the 54 that we released on Monday, 28 of them were on probation already for prior convictions, not just other charges. They've been convicted of those. So this idea that the folks that were released are just low-level offenders is not necessarily the case.
Thank you, Sheriff. We're going to switch gears a little bit and talk to Ruben about mental health. And obviously, this is kind of an unprecedented time in our history. A lot of people are struggling. What are you most concerned about?
Yeah, so as a county mental health department, we serve adults with severe mental illness, serious mental illness, and children with serious emotional disturbances and youth as well. And, of course, the physical distancing and folks, most of the time when we connect with folks, it's either through their schools or through a referral and things like that. So we're just concerned that folks are not getting out and getting the support that they need. Even beyond folks with severe mental illness, folks just in general, that is just something that helps us keeps us emotionally healthy and well. So we're concerned that that has a broader impact, and even coming out of the crisis, the economic impact will be the second wave, and the second part of this crisis that we'll be definitely preparing for and looking for to find ways to better support our community. So those are our concerns, and we're monitoring various parts of our system, our access line, our suicide prevention hotline. We're monitoring those and working closely with the Sheriff's Department and our local police departments to monitor their interaction as well, just to make sure that we are tracking anything where we start to see spikes or we start to see some concerns. We could work together, and I think that's also very important for us, and the concerns that we have, but also I just think the opportunity here too is just we have partnerships here that are working together to figure this out, and it's going to take all of us. It's just not going to be professional services and the services that we traditionally deliver in that way. We're going to need every part of our community to be really paying attention to this, whether you're a pastor of a local church or a business owner or a CEO of a large business, or you run an organization, run a factory or a farm, making sure that we are all being very intentional about addressing the mental health needs and addressing mental health impacts together. There are things that our businesses can do. There are things that large organizations can do, and all of those efforts together will basically help us all get through this in a much better way.
Ruben, I wanted to stick with you for just a moment. This next question, I think you hinted on it, but could use some further clarification. How are you keeping services going right now with our shelter-in-place order and office closures?
Yeah, so behavioral health services are considered essential services, so we are open, but we do have some changes that we made, and so we are seeing clients at our clinics and at our sites, and we're doing that with pre-screening. We're calling folks ahead of time just to make sure that they don't got any symptoms, and we have a screening tool that we've developed to help folks before they come in for an appointment. We're seeing primarily a lot of our clinic services are around medication, making sure folks are getting their medication. For those for folks that we need to see, we are seeing them in our clinics and our site. A lot of it is around our crisis services. But we have dramatically increased the amount of telehealth services, meaning with the amount of services we're providing by video or phone calls. The state of California dramatically changed, or even the federal government dramatically changed a lot of the policy related to these types of telehealth services. So we implemented those rather quickly. I think probably in over a weekend, half of our services went to telehealth. We have a large percentage of our staff working from home, calling clients, meeting with them on video. We rapidly increased the use of telehealth and video. And also what we're doing is also with the population we serve, some of them do get disconnected, so we are monitoring very closely folks that we've not been able to connect up with telehealth services and still having plans and strategies to reach out to them. And that is going to involve us going back into the field and into the community. So behavioral health services is different. A lot of it is changed just within the last couple of weeks. And I think and as we start to think about, pulling back the stay-at-home order, a lot of those changes will stay with us for a while. So we do have services open, and if you are, as I mentioned earlier, if you're concerned about your mental health or a loved one, or even if you were receiving treatment from our department or another one of our nonprofit or our contract agencies, and you've not had connection with the treatment team or your treatment provider in a while and you feel you need to, please call your program, call our access line 558-4600 and let them know that you've got disconnected with your service provider and you want to make that reconnection. So
Thank you, Ruben. So Dr. V, a lot of modifications are being made right now to help make sure we're meeting the health needs of the community. I'm understanding that there's an alternate care location being set up to accommodate sick people in the event of a surge. Can you tell us a little bit about that, and will it have the full capabilities of an ICU?
So no, it's not being set up to have the full capabilities of an ICU. People who need that level of critical care need to be cared for in a hospital. But what it will be good for is, if it's needed, taking the people from the hospital that are still need to have some level of care, but it's a lower level of care. So they still need to receive IV antibiotics, but they don't need, that level of critical care. And so they might not, they might still be infectious and not have a skilled nursing facility or something like that able to take them back. So they would be able to go there. So it'll help our hospitals have the rooms that they need to treat the more severely ill, but it wouldn't provide that level of critical service.
Thank you, Dr. V. So let's go back to another Facebook question. This one came in from Amanda, I believe, yesterday. Are there any updates on Stanislaus County getting an antibody test? I know that may still be in the process of being developed, but that would give her peace of mind.
Yeah, so I get a lot of questions about antibody testing. And there's problems with getting antibody tested. So the Cellex test that I know about that's FDA approved, it looks like it's a good test. The problem is that tests don't perform well when there's not a lot of positive people in the community. This is hard to explain, but I'm trying. So if there's not a lot of people in the community who've had the disease, so should test positive with this, even with a good test, a positive test is probably only about 50% accurate. So with the level of disease for COVID-19 we've seen in our community, I would expect that about half the positives would be a false positive. And to me, that's pretty dangerous to be making decisions that someone's immune when it's only about a 50% chance that they are. A negative test is probably quite good to say that it's there has not been disease, and so there is not immunity. But a positive test, when we have so little positives in the community, the false positives overwhelm true positives, and it's just not a reliable test. So it's a test we will use in the future. It's a test that can be used probably in a proportion of people, but it's not going to be a good test for the general public right now. We need to get the level up. Once you get up to, say, 30% of people should have a positive test, the truth is 30% should have a positive test, the test performs much better at about maybe 90% of the positives are true positives. So I hope that makes sense. Now is not the time to be using a test. The test is not going to perform well and give a true answer right now. And so I'm glad it's around. I think there are places it can be used, but as general community use, it's just not quite time yet.
Thank you, Dr. V. We have 3 questions for the sheriff that came in from our Facebook feed that have to do with enforcement of the stay-at-home order. Jana Stavros, for example, is asking what the county is doing to enforce the stay-at-home order right now.
So the stay-at-home order is a misdemeanor. That is the only crime that we can enforce related to it. It's a penal code section that essentially says it's a misdemeanor to violate a public health order. So with that, a lot of people talk about, well, why don't you just issue them fines? Well, for us to do that, functionally, we have to arrest someone. A citation for a misdemeanor is an arrest. Now, it's different than a custodial arrest. Someone's not necessarily going to jail over it, but it is still a misdemeanor crime that has to go through the court process. They have to be convicted of it in order for any kind of a fine or potentially a jail sentence to be imposed. And at this time when we are letting criminals out of jail to prevent this, no, this is not something that we are going to do. We are not going to make criminals out of normal people that are simply not following the rules. Now, here's what I would say. We are all in this together. We are going to get through this together. If everyone does not get with the program and follow the guidance that's been given out, this is going to last longer and be worse than anyone wants it to be. So if you are one of those people that is not doing those things, you need to stop and you need to follow the guidance that's been given. That is the number one thing that we need to be doing.
Thank you so much. There are a couple of questions, and you may have already addressed this, but there was a question about non-essential travel and whether fines would be issued for that. And then also another question from Crystal Vasquez. What is the county doing about people still having large garage sales and yard sales?
Yeah, on the business side is somewhat different. We have had a number of complaints about non-essential businesses, and we have kind of a whole business branch that has started to work on that. We have reached out to them. The various jurisdictions have handled it somewhat differently as far as who the contact people are, but we have approached several, I think we're up to about 150 businesses now across the county, and they are virtually all complying. And I will tell you that we all collectively appreciate that. And as we get further and further into this and continue to do more and more evaluation of it, for things like garage sales, some of those other things, we'll post the email, but I would ask you, send an email about that sort of stuff to that address. And that way we can start to look at those. It's not something, do not call 911 about it. Do not call the dispatch center, even the non-emergency number. We are not going to dispatch a deputy or an officer in a city to go handle that. Just report that. We will talk to them, and again, everyone that we have talked to, compliance has been great, and we certainly appreciate it.
Thank you, Sheriff. One more for you, and then we'll move on. This one came in from Facebook as well. The viewer is asking if we're still issuing CCWs, and since face coverings are not recommended for CCW holders, are they recommending they be worn at this time?
Yeah, we are absolutely still issuing CCWs. We are issuing new ones. We are processing renewals as fast as we can. We have changed the process, so if you're new to it, I mean, it's been 2 years maybe since you've had a renewal, please go to the Sheriff's Department website, read the FAQs, certainly reach out if you have questions. But we have changed it specifically to allow for more social distancing and to address the challenges that we are currently facing, but we are absolutely processing them. This is not the time to stop that, given the fact that we have more criminals out on the street, and I have fully supported CCWs. Now is the time to keep doing that. Now, on the specific question regarding the face coverings, yes, as a general rule of thumb, historically we have not wanted people to wear face coverings, but now with the guidance that's out there, if you choose to wear a face covering, by all means, wear a face covering. There should be no challenges around that. A quick trip from my office to where we're filming this right now, virtually half the population or more has some sort of face covering on, so it's perfectly fine.
Thank you, Sheriff. This next question is for Ruben, and this comes in from Bonnie, and it is in regards to special education and other resources. Bonnie is asking, I have a special needs grandson who is bouncing off the wall and has no guidance or follow-up right now from counselors and teachers. They were making some progress, and she's wondering if counselors who work for special education schools are still working.
So our organization does not. We're not the service provider for in general for the young child mentioned, but in general, what I would say is that if you do have a child or yourself have been connected to services before the COVID-19 crisis, and you're struggling and things are not going well, and you've lost connection with the service provider, I would recommend to this mom and other moms out there that especially if the child had a special need, connect back with those service providers, make some phone calls, get back to them, and make sure you let them know where you are and that you are having some concerns. As I mentioned, a lot of the systems have gone down to have retracted, or I wouldn't say retracted, have started to implement telehealth services, and there's not as many services being projected into the community. So there are going to be instances where folks lose connection. My recommendation is make some phone calls to the provider that you had before, the staff that you were working with, your school, and whoever else had those connections with you, and say, look, we're struggling here and we do need some help. So a lot of service providers right now are providing telehealth services and can connect with you over the phone, on your cell phone. There's a lot of really innovative ways that people are connecting right now. So that'd be my recommendation broadly.
Another question for you, Ruben. Right now, you've tonight suggested people stay connected to their support network or reach out to others who may need support. What would you say in recommendation about individuals who really don't have community support and they don't have school counselors, or they really are feeling hopeless but don't know where to go for support?
Yeah, well, before the crisis, this was also a significant concern for us in our community. The social isolation is one of those key things that we ask folks when we're talking about their mental health, and we ask them, are you getting out? Are you connecting with family or friends? Are your daily activities being hindered? And staying home is one of them, and isolating is one of those issues. So, it is a concern, and for those folks that don't have support right now, I think it's very important that they find some support, and at times it's difficult, and because things happen in our lives and a variety of reasons why we can't get that support, and if it's not possible for them to do that, again, I would ask them to call us at 558-4600, and we do have that line is actually our crisis line, in addition to what we call a warm line, and we have folks that will answer the phone on the other side and say, hey, they've been through those types of things themselves. We've got clinicians that answer the phone, as well as folks that have been through their own mental health struggles and have overcome and are in recovery. And so they've been there, they've done that, and they can talk to these folks about, hey, this was my experience and this what might be helpful for you. And in addition, we do provide referrals and help people build those connections, help build their peer support network and mutual aid. In fact, for folks dealing with a severe mental illness and beyond, getting connected to a peer support group, having folks you can connect with substantively is a very important part of treatment and a very important part of recovery. So so for those that find themselves isolated, and despite their best efforts, they've not been able to, call someone and get the support they need, and they're still in crisis and they're still struggling, give us a call at that 558-4600 number, and we can help even with those types of things and making some recommendations and some referrals. And we also do have some peer support program that is available for folks as well, where they need that extra support to help build those networks. So.
Thank you, Ruben. This next question is for Dr. V. You talked a little bit earlier about the antibody test, but I think it's probably important to clarify for folks what the difference between the antibody test is and the PCR test.
Yeah. So when I was talking about the antibody test and the positive value, what we call the positive predictive value, that's for the blood test. I don't want people to think that that's the same for the nasal swab test. That test is directly detecting virus, not a blood immune reaction to it. So if it detects the virus, that's very specific. So if the test is positive for the virus, it isn't going to be a false positive. It's going to be a true positive. So I didn't want people to think, well, those positives might not truly be positives. And so I just wanted to clarify that. Thank you.
So here's another social media question for you, Dr. V. I am a smoker, this person says. Am I more likely to get COVID-19? And what should I do?
So smoking is a risk factor for severe disease. So you're not necessarily more likely to get COVID-19, but if you get it, you're more likely to have severe disease. Smoking, it actually paralyzes the little hairs that are in your airway that's supposed to clear your secretions, and so it leads to more infections that way. And then long-term smoking, of course, damages the lung, and so it's harder to deal with respiratory infections. So the best thing you can do is stop smoking and vaping. This isn't just smoking. So stop, and your body can start to heal itself. It takes a while, but it will happen. So the best thing you can do to protect yourself is to stop smoking.
Dr. V, I wanted to stick with you for just one more moment. This is also a Facebook question from Ali Bolanos. We know that there's been a large number of people that have actually contracted COVID-19 but are asymptomatic. So Ali wants to know if we have any idea at this point when we'll see more testing for those that are asymptomatic.
Testing of people who are asymptomatic is a little bit problematic. We do know that there are people who don't seem to have symptoms, and that's a problem for spread. But the problem with the test is it's detecting the virus. So if it's positive, it tells you something. If it's negative, though, it really doesn't tell you anything. It tells you that it's not finding it that day. That doesn't mean the virus isn't going to be present tomorrow or the next day. So it's not very helpful unless it's positive. So a lot of people get exposed by a family member or something, and then they want to be tested, but the test just doesn't work that way. And so it's just not very helpful. First, our tests are pretty scarce right now, so it uses a test, but it doesn't give good information because you're most likely going to be negative, and then that isn't telling me that you're not going to develop disease in a day or two or three or even a week. So it really isn't helpful at all, in my opinion.
One more question for you, Dr. V. There are a lot of them coming in from Facebook this evening. Atina wants to know, why can't we know at least the ages of the people who've died due to COVID-19?
Yeah, so we always protect the identity of people, and giving specific ages is considered an identifier, and we don't do that. We will when we get a certain number of patients, like we did with the cases. Once we get a certain number that it's no longer a risk for identifying individual people, we will release more data on people who have died. But at this point, it really isn't appropriate to release it, as it would be considered a way to identify someone.
Thank you, Dr. V. This next series of questions are actually for Sheriff Dirksey. We have about 4 questions coming in right now about enforcement, especially of zero bail policies. So Patrick Sullivan is asking, is there any procedure in place if someone is released, a criminal reoffends while out on zero bail, to keep them in custody?
Yes. So let me kind of expand on that. This whole zero bail thing it's put in place by the state. This is not something that we chose to do locally. There was no need for it for any of our criminal as far as capacity. We have a very good process in place for our jail as far as preventing the entrance of the coronavirus. So with that, the zero bail, it does apply to both almost all misdemeanors with a couple of minor exceptions and many, many felonies. I know I've kind of heard people say, I didn't realize that certain thing, isn't that a felony? Well, yeah, it is, and many of them do qualify for zero bail. That's just the situation that we've been dealt. But with that, as I spoke earlier, our district attorney's office has been working very, very hard all week on doing bail enhancements. So if someone qualifies for zero bail, given the guidance that we have, the district attorney's office can petition the courts through a bail enhancement motion to raise their bail even beyond the zero. So they've been working on that, and it's also something that, as moving forward, we can do that as the sheriff's department or any of the other police departments, or through the DA's office, that these people that are repeat offenders, as many of them that we've already released are, they are repeat offenders. If they offend again, we can ask for an enhanced bail, so something beyond the schedule. But that requires a judge to specifically sign off on the zero bail, or on the bail enhancement for that particular person and that particular case. So yes, we can. We've already worked on it. The DA's office has taken lead now for this last week. Moving forward, we are absolutely exploring that, and we'll do it whenever it's appropriate, because for these folks that are out there causing grief to the community, they belong in jail.
I think you may have already addressed this question, but Jessica Pittman was asking more for numbers. So Jessica is asking, how many times will someone be arrested and released before they're able to be kept in jail?
So with that, again, if their offense still qualifies for zero bail, technically they would be cited right back out. Now, with that, as I've just explained, we can approach this bail enhancement thing or process. So what we are doing through our own systems is we are tracking those who are released on zero bail, and if they reoffend while they're out on zero bail, we are absolutely going to seek a bail enhancement so that doesn't occur again. I know in San Joaquin County, I spoke with their sheriff last night, and in less than 24 hours, he had 2 or 3 that had already reoffended. And so I'll be honest, we are waiting for that here. So it's going to happen, and we are absolutely going to explore that route as far as upping their bail to keep them in custody.
Thank you, Sheriff. This next question will be for Ruben. We have a question coming in from Denise, who's asking what resources are available for people struggling with severe mental illness issues that have arisen with this virus who don't have insurance.
Okay, so what I would say is, as I mentioned earlier, there's a variety of options in our community in the state of California in these scenarios, and the best thing to do is to call our access line, the 558-4600 number, and share with them what's going on, and they can refer you to an appropriate service provider. I will say for those also that have insurance, it's important to let them know that as part of most of the health plans in our community, at least, if you are struggling with a mental health issue, one of the other options is call your health provider and let them know what's going on, and ask them if they have somewhere where they can send you. A lot of the health plans do have those types of services. They're less intense than the county mental health service, and for many people in our community that are experiencing this issue and having some concerns about their mental health issue, they could benefit from calling their health plan or their doctor and letting them know what they're struggling with, and getting them connected to therapy or counseling. So that's what I would recommend for both folks that have insurance and that don't have insurance.
Ruben, I'll stick with you for just a moment because we have a couple of questions coming in from the Facebook feed. Rosa says that she has a son at Atascadero State Hospital, and when they release him, she's wondering if she can get help to place him because he needs supervision.
Oh, okay. So I can't speak specifically to that situation, but in general, what I would say is that our behavioral health department, especially locally, is partner. Anytime we're seeing these, anytime someone is released from our jail or probation, we have ways to assess whether or not these folks have a severe mental illness or a substance use disorder, and they could benefit from behavioral health services. So locally, those partnerships are there, and we have ways to connect and communicate around folks that are receiving treatment. And as far as her loved one that's incarcerated, I would encourage her, and for those that maybe have family members that are in the prison system, the state prison system, that if they are released, that they're working with their parole to make sure that if they do have a mental health issue or a disability, that they're making those connections locally. And that's a priority in most of the correction systems. They are doing that work. And so if someone does have a loved one in that situation, they usually have a social worker or someone that's working with them on a discharge plan to get them connected to services when they come back to their community of origin. So.
Okay, Sheriff, I'm going to ask you a question now, something we haven't really talked about in a couple of weeks. Cybercrime. So cybercrime has been a problem, obviously, in recent years, but it seems really prevalent now with online predators looking to take advantage of people. We've seen fraudulent COVID-19 testing or antibody detection ads online, and we've also heard about fraudulent sites claiming that if you give them your information, they will get you a small business loan or grant. So how do we know what is reliable information?
Well, I think the simplest answer to that is go through the State Emergency website. We are only going to post the real sites, the real links. Anything else, I would agree, is probably fishy. As in any other situation revolving around this cybercrime type of stuff, don't click on phishing ads. Anyone that sends you something like that, there is something in it for them. Whether it's criminal intent or they want some cut or percentage or fee for doing what you yourself can do, there's something in it for all of them. So simply don't buy into that. No one is going to call you randomly from a number that you don't know about how they can give you money, so don't do it. Same thing with those emails about how they're going to help you with that. Don't do that. If you need assistance with any of that stuff, go to the State Emergency website or call the 211 number and talk to our team that can help direct you to the right places. That's the kind of stuff that's going to prevent you from falling victim of that, because you're absolutely right. It is happening higher right now. We've had many cases of it, and they are extremely frustrating cases to try to resolve.
Thank you, Sheriff. We're getting multiple questions right now for Dr. V. Questions about reporting cases by city. Are we doing this, and where can people go for more information?
So, stanemergency.com. So if you go to the county website, there's a lot of data posted there, age groups, by city, total numbers. So I would suggest you, for the most up-to-date information, to go to stanemergency.com.
Thank you, Dr. V. Another question for you. Now that there has been such broad transmission, we hear that CDPH, Public Health for the state, is now releasing COVID-19 race-related data. Have you seen this information, and does it appear that certain groups are more susceptible than others?
So yes, they have that posted on their website, and I have seen it. So this is a respiratory virus. It doesn't care what color your skin is. It's going to infect if you get exposed. So it's not, race isn't really a sign of susceptibility or anything. What we see, though, is poverty is actually where we see the most spread and more severe disease. So people in poverty tend to live more closely together. So there's more crowding, and they tend to have poorer health, can't afford health care. So they're at risk for more severe disease. And that's really what we see when we're looking at these numbers, is that it has more to do with really poverty, because the virus doesn't care.
Thank you so much, Dr. V. This next question is for Sheriff Dirkse. This is an interesting question. We haven't seen this one before. Cybercrime has been a problem in recent years. Oh, I think you did actually address this question, so I'm going to move on to the next one. This is a question from Facebook. We've also seen quite a bit of conversation about this. Can you explain why golf courses are closed when there are other options where people could drive their own individual carts and clubs and stay far apart from each other?
Yeah, the golf course question has come up, and we obviously understand that there are many folks that love golf, and it's good exercise, which is specifically exercise is allowed under this. The challenge with golf is that many places do not respect the social distancing, and it's that kind of communal community type of atmosphere that goes with golf. And now with where we're at with our numbers and kind of looking at increasing numbers, now is not the time for us to reopen a golf course. However, we are evaluating ways that can be done in the future, specifically with strict social distancing guidelines, modifications to normal rules of maybe not the rules of play, but the way that people play, i.e. just 2 instead of 4. So we are looking at that, and what our hope is that within the next few weeks we'll be able to put out something to that effect, allowing golf courses to reopen, but do so in a responsible manner to help us fight the virus.
Thank you, Sheriff. Speaking of things that people miss, like golf, Ruben, this last question is for you. People are also missing their support networks, their business colleagues, schoolmates, church families, etc. So how would you recommend people keep an emotional connection?
Yeah, so like I said, social isolation is one of the stressors that is, does lead to some of these things that we struggle with around mental health. I would say, this is a time, and as I mentioned, it's unprecedented. It is a public health crisis, not just with the virus, but just the social connection and the risk that poses for our community. I think it's just as we've done with the crisis in terms of risk mitigation and being really intentional and thinking really differently and big about how we address this. We need to start thinking about that in terms of making and connecting socially. And Dr. V has mentioned, this is about physical distancing, not social isolating and disconnecting socially. So I think folks just need to be very intentional about it and start to develop plans and thinking about how they do that. And part of it also is I think, as I mentioned earlier, part of our broader community needs to start thinking about this as well. It's interesting to see some of the things that are happening in terms of people being creative about connecting with folks. And for those that are really struggling with a mental health issue, sometimes being creative and doing that is not an option, and you're just not in a state of mind where you're able to do that. So I think, like never before, I think we need folks taking time to check in on each other, to call. I encourage everybody here, call 5 people that you're connected with that maybe you have not seen in a while. Maybe you've known in the past they've had some struggles, maybe with a substance use issue or a mental health issue. Call them, check in on them, and say how you're doing. If you are struggling, call 5 people and ask for support. I know that's difficult at times, but I think this is a challenge for all of us, and I think we need to make those extra efforts. And for those that can't find that support, again, call us, and we'll do our best to help connect you in real ways to folks that can support you. And the last thing I say, I think Jeff, our sheriff, has said this multiple times. It's going to take all of us to get through this, and I think that is true even emotionally and socially. We really need to work on this together. And but even coming out of this, and I know that there are folks that are thinking about what can they do. It feels like I can't do much from my living room or being stuck here at the house right now. I encourage those that can, get on Zoom, get on, the phone, and start connecting with your networks. If you run a nonprofit or you're a business owner, you run a large organization, start thinking about the future. Start thinking about, as we get through this, how are we going to connect people back again in real ways? How are we going to be able to support folks getting back to some sense of normalcy? And, we imagine that there's going to be some coming back, to some sense of normality, but there'll be a new normal. There'll be a new way that we have to be together. So I just encourage our community to really start thinking about how we can socially connect. And, hopefully and for those that can, you can always call us, and we're going to do our best to connect you in ways that make sense. So thank you.
Thank you so much, Ruben. I think that's an excellent positive message to end on this evening. And I wanted to remind folks that may have joined us a little bit late, if your question was not answered and maybe you missed it, I would encourage you to go back to the beginning and watch this over again, because your question may have been addressed a little bit earlier. And with that, we wanted to thank all of our panelists for being here tonight and for contributing to this community conversation.
We also want to thank you at home for participating and sending in your questions. Keep them coming.
You can find us on YouTube under Stanislaus County Office of Emergency Services and on our website at stanemergency.com. And you can find our updates on Facebook, Instagram, and Twitter. Just search for the word Stan Emergency.
So thanks again, and we'll see you next Wednesday for another Facebook Live Q&A at 5:30. In the meantime, stay home, stay informed, and stay healthy. Good night.